cephalocaudal and proximidistal pattern. The cephalocaudal trend is the postnatal growth from conception to 5 months when the head grows more than the body. The proximidistal trend is the prenatal growth from 5 months to birth when the fetus grows from the body outwards. Height and weight. It's normal for newborn babies to drop 5 to 10% of their body weight within a couple of weeks of birth. Next is brain development. Among the most dramatic changes in the brain in the first 2 years of life are the spreading connection of dendrites to each other. The next one is myelination or myelinization, the process by which the axons are covered and insulated by layers as fat cells begins prenatal and continues after birth. Motor development. Along these aspects of motor development, infants and toddlers begin from reflexes to gross motor skills to fine motor skills. The next one is reflexes. The newborn has some basic reflexes which are, of course, automatic and serve as the survival mechanism before they have the opportunity to learn. Sucking reflex. It is initiated when something touches the root of infant's mouth. Infants have a strong sucking reflex. The sucking reflex is very strong in same infants, and they may have need to suck on pacifier for comfort. And the next is rooting reflex. It is the most evident when an infant's cheek is stroked. Baby responds by turning his or her head in the direction of the touch and opening their mouth for feeding. And the next one is gripping reflex. Babies will grasp anything that is placed in their palm. The strength of this grip is strong and most babies can support their entire weight in the grip. And the next is curling reflex. When the inner sole of a baby's foot is straight, the infant responds by curling his toes. When the outer scale of a baby's foot is stroked, and the infant will respond by spreading out their toes. Startle or motor reflex. Infants will respond to sudden sounds or movements by throwing their arms and legs out and throwing their heads back. Most infants will usually cry when he started and proceed to pull their limbs back into their bodies. Gallant or gallant reflex. It is shown when an infant's middle or lower back is stroked next to spinal cord. The baby will respond by curving his or her body towards the side which is being stroked. And the next is tonic neck reflex. It is demonstrated in infants who are placed on their abdomens. Whichever side the child's head is facing, the limbs on that side will strengthen while the opposite limbs will curl. Gross motor skills. It is always a source of excitement for parents to witness dramatic change in the infant's first year of life. This dramatic motor development is shown in babies unable to even lift their heads, to being able to grab things out cabinet, to chase the ball, and to walk away from parents. Fine motor skills. These skills is involved a refined use of the small muscle controlling the hand, finger, and thumbs.